Yakomberwa mayo yakomberwa yakomberwa mayo yakomberwa nabiyamdani naona tinyama.
Kwale County is one of the 47 counties in Kenya. It is located in the coastal region of the country. The population of the county as per the 2019 census was about 900,000 people, occupying a landmass of 8,720 square kilometers with over 173,000 households. Sanitation has been a major problem in a majority of areas in Kwale County over the years, with safe drinking water being insufficient and open defecation being the norm. This has posed a great health risk for the residents. Many efforts have been made to reverse the situation.
Huduma hizi za kuimarisha mambo ya vyoo ili watu wasiende haja peupe ilianza kitambo. Kuna mashirika kadha wa kadha hiyo miaka ya nyuma 1970s mpaka 1980s. Kulikuwa kuna mashirika kama SIDA ambayo yalikuja Kwale, na kwa vile waliona hali ya kutumia utumizi wa vyoo ni kidogo, wakaanza program za kupeana slabs na bomba kwa watu kuwa na vyoo. Hali hiyo iliendelea, lakini haikuimarisha hali ya matumizi ya vyoo katika gatuzi la Kwale. Mwaka wa 2006 tukapata mfumo mpya ambao huu mfumo unaupongeza kwa sababu ndio umegeuza mambo ya matumizi ya vyoo katika gatuzi la Kwale. Mfumo huu ni ule kwa kimombo tunasema community led total sanitation, ambao ilianza kutekelezwa Kwale. Na mfumo huu wa CLTS ni ule mfumo wa kwamba mwananchi awe na choo, either ni choo ya aina gani ama ni aina gani, lakini awe na choo na awe anaitumia.
With CLTS, we have been able to convince them to put on and come up with the toilets. And these toilets were different in different communities and in different locations. And now, after we reached above 50%, we were confident enough now to call in the consultancy who has been doing and supporting us with the improved toilet consultancy. And now, what is the difference? The Bora Choo now to the improved toilet, which we were calling Choo Bora.
The national government, through the Ministry of Water, Sanitation and Irrigation, the county government of Kwale, and with funding from the World Bank, are working together to improve the situation in Kwale.
The government of Kenya, through the Ministry of Water, Sanitation and Irrigation, signed an agreement with World Bank, IDA, for financing Mwache Dam, which is in Kwale County, and which is intended to serve the city of Mombasa and some parts of Kwale County in terms of water supply and irrigation water for Kwale County. Through this undertaking, Kwale County, which is hosting this dam, will also benefit from a number of development interventions, which include water supply, irrigation, livelihood support, and sanitation for the communities around the dam. This project is through a loan of currently 200 million from IDA, and some funding as well from the government for resettlement, compensation for the communities that will be displaced by the dam. So through this initiative, the government is working together with the county government of Kwale to carry out the Kwale development program, and the sanitation subcomponent is one of the initiatives that have been undertaken.
For sustainable change to happen, the problem had to be properly defined and a strategy developed to tackle the problem.
And we have been very glad to have partnered with LM Marketing and Communications Company to be able to achieve this. And we have been able to reach out to the communities through community health volunteers going to house, taking the message of improved communication. We have been able to do this through, training artisans artisans are very essential because they are the ones who give the communities that capacity to be able to build an improved toilet.
LM Marketing and Communications has been working with the Public Health Department of the County Government of Kwale, Red Brick and the Father's Daughter to this end.
We basically brought different skills together for this project. With the support of the project implementation unit and the project monitoring unit, we've been able to run the entire project for a period of just about 15 months, having got a 3-month extension. It's good to say that these were really interesting times to implement the project in Kwale because of the COVID situation. So we really had to rethink our initial strategies, and I'm happy to say that we adopted them and were still able to be successful in what we needed to do.
LM's theory of change, with its 5-pronged approach consisting of provision of tools and services needed to support behavior change, creating strong communication campaigns that shift behavior, working with policymakers that support behavior change, creating partnerships that create synergies, and creating and strengthening capacities that support these behaviors was employed.
In our methodology and in the components that we brought into this projects, we made sure that at every level we looked at those things. And that in many ways addresses what in WASH, or in water, sanitation and hygiene, we refer to as hardware and software. And I think that when we are able to bring those two things together, we can create impact, we can create change, and possibly create sustainable change.
The project had several stages that addressed the different challenges.
This sanitation intervention has involved a number of elements, including training, including support to various sanitation practices among the communities. And therefore this is intended to improve the health and hygiene of the communities in the area, accompanied by the economic benefits through the support to their livelihood.
This project has been worked together with the Public Health Department of Kwale County. We've worked together, and it is the third of the projects that we are doing. The first project that we were doing was to ensure that the certification project for what is called open defecation-free villages has been affirmed. Now, open defecation-free villages are villages where no household is practicing open defecation. By that I mean every household has a toilet, and also they appreciate the fact that they have to use the toilet for purposes of defecation. And then now the last phase has been to come up with improved toilets, improved sanitation campaign. This campaign, the purpose has been to ensure that every household is aware of the option of an improved toilet facility.
ALAM partnered with the project implementation and project management units to achieve the desired goals.
So this project of sanitation in Kwale County is targeting to ensure that the villages that are around the catchment of Mwache Dam have such effective ways of dealing with sanitation and sewage disposal, so that they do not in any way contaminate the dam. The dam, Mwache Dam, is meant to be a drinking water supply source for part of Kwale and also mainly for Mombasa County.
In this project, we proposed to introduce 2 specific products. One of them was the Makiga bricks. The Makiga bricks are easy to do. They're easy to train households to do because they're inexpensive, and they provide the product that households need to then build an improved toilet. And the other one was the plastic toilets, or the Sato pans, that are private sector manufactured and private sector promoted, which provide an option for households to already immediately improve an existing toilet to make it safe and hygienic to use.
The project has had a positive impact on the community, both in the reduction of the potential health risks associated with open defecation and the economic empowerment through the CBOs, the community-based organizations.
So what has happened with this particular consultancy, they have come up with what is called Makiga interlocking bricks machine. This enables interlocking bricks which can enable you to construct especially the upper wall of the toilet, the walls, very quickly and with very little costs.
8 community-based organizations were selected by the county itself, and these community-based organizations, which consisted of community health volunteers, were trained. They were trained, and they were also given Makiga brick making machines as a grant to them. So they were trained on how to make the bricks, they were trained on how to build a latrine, and they were trained on basic business skills. And this is what LM did for the community-based organizations.
When they were given the machine, the Makiga brick making machine was bought for them, they had to learn with artisans from the community to know how to use this machine. This machine was going to be an investment to them for multiplier effect, to get money and also to improve toilets, not limited only to toilets. They were also supposed to hire it out to even improve houses.
Kwa saa hii tayari Makiga ishaanza kufanya kazi na imeonekana nyanjani baada ya kulaunch na kutrainiwa kwamba tutatumia vipi, na tukajenga choo cha demonstration pale ambacho pia tulikijenga sisi HVs kuonyesha community. Hapo unafikiri tulipata order tayari. Pia katika hii kazi ambayo tunaenda nayo ya Makiga, tumeweka sheria zetu zinatuongoza, na kati ya hizo sheria ya kwanza ni vile tutakavyofanya kazi kule na vile ambavyo kile kipato cha kule tutakigawanya ili kitusaidie kwa saa hiyo na baadaye.
Sasa hii Makiga tunasema ya kwamba tunashukuru kwa sababu LM wametupatia ndoano tuende tukavue samaki, kwa sababu sasa sisi wenyewe tutashughulika na hiyo kazi ya kutengeneza Makiga ili iweze ikatusaidia, kwa sababu tukiwa tuna vikundi vya wamama, tukipata pesa kama hiyo kwenye Makiga, tunaenda tukitoa na baadaye ikikusanyika inakuwa nyingi, tunapata faida kama ni kununua vyombo vya nyumbani ama pengine kusomesha watoto.
Sasa LM walikuja kutusaidia tujaribu tutoke kwa Bora Choo, tuende kwa Choo Bora. Katika muda mchache kila mtu Nzombo atakuwa na Choo Bora badala ya Bora Choo.
Mashini nimesikia kwamba kuna mashini imekuja katika dispensary kwa kikundi kiko pale cha wale wanahusika na vyoo. Alafu nikaenda nikaomba hapo, nikapewa kwa bei nafuu. Nimeonelea vizuri kujenga choo na matofali haya kwa sababu nimeyaona yako katika hali ambayo inapendeza katika ile design yake. Ilikuwa ni rahisi kuyatengeneza, haikuchukua muda mrefu na haikuchukua material mengi, ni mchanga tu na kama na simiti kidogo.
Going forward, for sustainable change, there needs to be continued support for the community health volunteers and the community-based organizations in terms of training, engaging the community, and funding of initiatives like the brick-making machines.
And these CBOs, the criteria for selection was key for us as a department. Number one, the CBO had to be a community unit group. And the community unit is that because this is a structure within the health department, we are assured of continuity. So another item that was key for us to have a community unit is that sanitation is just one of the items that these communities go house to house to give messages within the community. So whether the project is there, whether the consultant is there or they have left, these community health volunteers will continue to pass health messages to these households and to these communities during their dialogues, during their health action days.
The consultant had a very limited period, just 1 year, and also limited scope. You will realize we had activities that include putting up demonstration toilets in various areas within the county. Now these are only, if I remember correctly, eight demonstration latrines that cannot realistically adequately cover the whole county. As county government, we are looking at enhancing those efforts and spreading them wider across the county. So these very important messages are able to get to all the rural areas that we are targeting.
And we have no doubt that as the project now comes to a close, that these CBOs will all sustain the businesses that they're already running. We are excited to see the CHVs really coming together and committing themselves to going on with the communication for improved sanitation, carrying on with visits to households, introducing the improved sanitation options. And we see them now looking very motivated when it comes to really running the sanitation business.
A lot has been done, and a lot remains to be done in further improving sanitation in the region.
There are still challenges within communities. We know that behaviors take time. Behavior change can be slow in places, and there's no magic wand in any way. And our experience is that we need continuous follow-up. We need to continuously listen. We need to continuously support volunteers. We need to listen to the public health officers for challenges that are emerging. We need to understand sometimes the underlying challenges that cause CBOs to not be effective or communities to not adopt a behavior. So looking forward for this project, looking forward in Kwale County, I think that the county needs to closely support the community health volunteers, closely support the community-based organizations so that they continue working and so that they thrive. With the approach that Kwale County took for this campaign, progress is being made, success has been reported, and this is replicable in many other places in this country, in Kenya, the country of Kenya, and around the world.
Baba ko kunaniko, kunani baba ko kunaniko.